I think physiologic and natural birth are growing in the US because people are realizing that they can take their power back. There has been a very long history of obstetrics in the United States taking power away from women in all sorts of ways. But I think women are, maybe because of social media, we can kind of see like what's acceptable and what's not, and people probably didn't really think about what was acceptable and why before this, but now they're seeing like all over the place people who are having better birth experiences and they want that for themselves.
I think because now there's a little bit more awareness. I think there's a little bit more access now. I didn't know about the Birth Center of New Jersey until I was in midwifery school. And that's when I kind of like started knowing about, oh, there's another option for delivery. And I think that now when it comes to like social media and previous patient experiences also have kind of like brought about the other option available for patients, which is, birth centers. And now I think that there's also like more midwives available. Like I said, there's kind of like more awareness, not only about the birth centers, but also about midwifery care and what midwifery care kind of like entails in general.
I feel like a lot of women are trying to like take back their power when it comes to their birth and their birth experience. I think even though midwifery has been along since test of time, the whole hospital system and kind of like, oh, well, my doctor said this, so this is what I went with, is kind of going out the window, because with social media and just being more knowledgeable about things you learn, kind of like taking back that autonomy to be like, no, this is my birth experience. I want it to be my birth story and have like an actual play in how things go.
I think a big part of that is that with more research starting to happen in the area of obstetrics and childbirth, we're seeing more and more that less is more, that less intervention is a more productive way to go into labor on your own if you're able to, all of those sorts of things, that it can be safer for you and for your baby to have less during the process of labor and birth. If you're not looking for things like epidural, if you're not looking for a higher level of medical monitoring for you and your baby because you don't have a medical condition, then why not be somewhere where you get personalized care, where you can have your own food, where you can have your family members come in and out, where your children can be sleeping on the couch outside, I think it's really enticing as people are moving away from the more medical model.